What are the latest immunotherapy advances for lymphoma treatment? Imagine a new wave of treatments that work with your immune system to fight lymphoma more precisely and effectively. Recent advances in immunotherapy are transforming how we approach non-Hodgkin lymphoma, offering hope beyond traditional methods like chemotherapy and radiation. One of the most exciting developments is CAR T-cell therapy. This process involves collecting a patient's T cells, which are immune cells, and engineering them in the lab to recognize and attack lymphoma cells. These modified cells are then infused back into the patient, where they seek out and destroy cancer cells. CAR T-cell therapy has shown remarkable success, especially in aggressive B-cell lymphomas such as diffuse large B-cell lymphoma. It is currently approved for cases where the disease has returned or not responded to other treatments, but researchers are exploring its use earlier in treatment and in other lymphoma types. Another promising area is bispecific antibodies. These are specially designed proteins that can bind to targets at once. For lymphoma, they usually connect a cancer cell marker like CD20 with a T cell receptor such as CD3. This dual binding brings immune cells directly to the cancer cells, boosting the immune response and leading to targeted killing. New bispecific antibodies like glofitamab have shown significant activity in clinical trials, especially for follicular lymphoma and diffuse large B-cell lymphoma. Several other bispecific agents are still in development, aiming to improve effectiveness and reduce side effects. Immune checkpoint inhibitors are also making waves. These drugs block pathways that cancer cells use to hide from the immune system, such as PD-1 and PD-L1. While they have transformed treatment for some cancers, their role in non-Hodgkin lymphoma is still being studied. They seem particularly promising for lymphomas associated with viruses or those with high checkpoint molecule expression. Ongoing clinical trials are testing combinations of checkpoint inhibitors with other therapies to enhance their activity. Immunomodulatory drugs, like lenalidomide, are another important advance. They work by stimulating immune cells and altering the tumor environment to make it more hostile to lymphoma. These drugs are already part of treatment regimens for certain lymphoma subtypes, including follicular lymphoma and marginal zone lymphoma, often combined with targeted therapies to improve outcomes. Researchers are also exploring emerging therapies and combinations. For example, vaccines designed to stimulate the immune system against lymphoma are under investigation. Combining immunotherapy with radiation or targeted drugs might boost responses, especially in indolent or slow-growing lymphomas. New agents targeting immune pathways, such as IRAK4 inhibitors like imavusertib, are also being studied, including for lymphomas involving the central nervous system. While these advances are promising, it's important to remember that immunotherapy is complex. Factors like patient selection, timing, and managing side effects are crucial. Personalized treatment plans created by lymphoma specialists help ensure patients receive the most appropriate therapies. Cost and access can also be challenges, but ongoing research aims to make these treatments more widely available and effective. In summary, the latest immunotherapy options for non-Hodgkin lymphoma include CAR T-cell therapy, bispecific antibodies, checkpoint inhibitors, and immunomodulatory drugs. These approaches are increasingly integrated into treatment plans and continue to evolve through clinical trials. If you or someone you know is considering these options, it's essential to consult with healthcare professionals who specialize in lymphoma to understand the best, most current treatment strategies tailored to individual needs.